Yeah, so my first, I guess, introduction to convenient urgent care, they were providing masks and supplies for people who didn't have supplies during COVID. And I went to pick them up and was going to take them around to some of the local areas. And I ran into a brother named Aijaz Syed. And as I began to talk to Aijaz, it was very, very clear that this brother had a vision for community service. Oftentimes, when you have urgent cares in a situation that they're not necessarily doing a prevention or education. He came up with the term a home of the smart patient, and I understand what that means. It means that people really want to be in tune about their health, but at the same time, they also want to be in tune about the people who are providing health. This is a very organic relationship. And little did I know, a year or so later, I would actually have to call on their services when I was in dealing with some physical trauma, if you will. And I have to say, they held my hand and they took me through the process. The offerings of telehealth, the offerings of being able to walk in consistent. I was in pretty bad shape, but they treated me like I was the president of the United States, not that one, Obama. Okay, I'm joking. But what I want to say is the professionalism, the dedication, the care, compassion, and the consistency of all the things I just named makes convenient urgent care the space you want to go to. 3 locations in the Houston area: Cypress, Pasadena, and Parker Road in Houston. But I want to say the overall conceptual understanding of convenient urgent care is that they care for their patients, even when the patients don't know how to care for themselves. Check them out.
All right, everybody. Assalamu alaikum warahmatullahi wabarakatuh. I'm comedian host Preacher Moss, host of the S.O.S, the shout out show. We have an excellent show today. We're going to be celebrating. We're going to be talking about healthcare. We're going to be talking about the concept of urgent care. You just saw an ad. I ran that ad for a particular reason because we are in this space, in this small bit of time. So work with us because it's going to go quickly. We're going to be talking about urgent care, but we're going to be talking about specifically in the city of Houston. We're going to be talking about convenient urgent care. And we have with us today, alhamdulillah, we have brother Aijaz Syed, who is the CEO. I tell people, you talk about how Allah works. He might not be there when you want to. He's always on time. This is an interesting thing because right during a space of COVID, a good brother, Zain Patel, gives me a call. He's like, hey, do you know anybody that needs masks and hand sanitizer, all these things? And I'm like, well, yeah, because I'm going to go get him and take him to the masjid. And he gives me this number, and I go see this brother, and we picked up on a connection, a friendship that's lasted the last couple of years, really understanding the scope through his eyes in many regards that, this whole idea, this whole concept of urgent care throughout the city, what it means, how it operates. And we're very fortunate today because they're going to be celebrating the 10th anniversary. It's going to be this Saturday. I'm going to get the information. I have it, so forgive me. It's going to be this Saturday. We are fortunate to have Aijaz on the show. He's going to be telling us a little bit more about this whole project, this whole process, how we got here. We're going to do a little background with him as well, because we always say sometimes the personality of the workplace is shaped by the personality of the person who manages the workplace. A couple notes I want to make sure I do. Shouts out, peace and blessings for those who are in the submarine situation off of Newfoundland. I don't know what that situation is. I've been watching it throughout the day, throughout the morning, and I don't know what the situation is. I haven't checked, but please make dua for those who are affected and families that are also affected. That's number one. Number two, if you're in the city of Houston, make sure you check out Convenient Urgent Care. And also, I want to give a shout out to Miss Eleanor, who's also in recovery. And I want to give a shout out to a beautiful young lady, Ms. Miriam Isabella Morse, who just had her 16th birthday today. So shout out to her. All right. So listen, we're going to take a break, pause for the cause, if you will. We're going to come back. And what you guys are going to do is you're going to chill out and get ready for this show because we got a barn burner for you. Okay. So don't move. This is Preacher Moss, the shout out show, bringing on Aijaz Syed, the 10-year anniversary. Convenient Urgent Care. Don't you move.
Assalamu alaikum warahmatullahi wabarakatuh, everybody. I'm comedian Preacher Moss. I hope you're having a blessed Ramadan. Listen, I just want to take a couple of minutes of your time to talk about Olive Branch Muslim Family Services. You know, Olive Branch Muslim Family Services represents a lot in the city of Houston. You have a lot of relief organizations throughout the country, throughout the state, but I have to say Olive Branch Muslim Family Services is one for the home team of the city of Houston. Listen, let me tell you about myself. I've always lived this idea that I'm always going to have more blessings than I'm going to have problems. And in that space, I've been able to be able to understand that the blessings sometimes mean I can be a blessing in somebody else's life, much the same with Olive Branch Muslim Family Services. Years ago, maybe 2 years ago, we had a video and it asked the question, the profound question. Imagine if it wasn't an olive branch. Not so much the organization, but the absence of compassion and mercy. Imagine if there wasn't an olive branch. Not so much a question, but a reminder of prophetic tradition that all of our prophets who have come came to advocate for the poor and uplift the suffering. Imagine if there wasn't an olive branch. Thinking about that. OBMFS. I changed the letters from Olive Branch Muslim Family Services and dug a little deeper, thinking about that prophetic tradition. So Olive Branch Muslim Family Services is really Olive Branch's mission is family success. We need your help. While you're writing out that check, brothers and sisters, think about that. What's a world without compassion? What's good music without good instruments? What's a president that's distrustful and not honest? Okay, let me get back focused. In any event, imagine if there wasn't an olive branch. Let me remind you.
We just we just need help.
Imagine if there wasn't an olive branch. Muslim Family Services at your command. The people who help people have to say, we need your donations, don't delay. We all have struggles from time to time, but leaders dedicated is what you find. Before another person sheds a tear, support Olive Branch, you don't have to fear. Olive Branch Muslim Family Services. Action you can see, compassion you can feel. Sing it with me. Ooh. Ooh. And we're back. Assalamu alaikum warahmatullahi wabarakatuh, brother Aijaz. How you doing today, sir?
Wa alaikum salam wa rahmatullahi wa barakatuh. Doing just great. Good to see you, preacher.
Hey, man, as always, man. So how is Houston right now? I heard it's boy, but it's hot down there.
Yeah, it's pretty hot. We have summer and you know the other season is not summer. It's
The other
it's
side,
rough right now, and yeah, we're trying to stay inside.
one season is summer, and the other season is hell. There you go.
Yeah,
There you go.
exactly.
You got big things coming up, man. Tell me about this 10th anniversary.
Yeah, we're very excited. Actually, tomorrow is our technically our 10-year anniversary.
Mm-hmm.
We opened in on June 22nd of 2013. That day we saw one patient.
Okay.
We've been through a lot. We've experienced a lot. We've grown by leaps and bounds. Now, you know, we might, you know, we could easily see 40, 50, 60 patients in a day. We have 3 locations. We've been able to, you know, get involved in more, you know, kind of deeper aspects of healthcare. You know, we just recently started a weight loss program.
Mm-hmm.
We've looked at other services as well, IV related services, but you know our primary concern is urgent care services, and you know it's been a tremendous you know time of growth. We've actually had you know I describe it as pretty much every aspect of your being is being tested, developed, strengthened, supported. You know the religious, the you know spiritual, the you know business aspects, etc. Everything you know that you can think of. 10 years is a long time. This is a huge milestone for us, and we're really excited about it.
So let me ask you this before we get deep into this conversation about yeah, because people need to understand that urgent care has been around since like the 70s, like the early 70s, and understanding that the growth of urgent care actually came from the hospitals, and then they developed these urgent care facilities, and then you have private. You have private urgent cares and things like that. When you look out in the market right now, man, what do you see kind of where do you see the trend of urgent care going, specifically after COVID? You know, when COVID was around, everybody's trying to get tested. That was a whole different type of economy. I don't think we'll ever see it again at that level. Where do you see the scope of urgent care moving to right now?
Well, it's a very interesting question and very timely. One of the biggest effects that we're seeing, um, now I don't know exact numbers. I'm kind of speculating on this, but
Mhm.
if I look around the urgent care space, I would think that less than 10% of the urgent cares in existence are
Mhm.
family owned, family operated, like us. The majority of urgent care clinics are being, driven by hospitals, hedge funds, private equity firms, etc. It's kind of a very unique time because if you look at from a legal perspective, we're in Texas, so I'll speak to that. Texas has a corporate practice of medicine law, but you still see private equity firms, hedge funds, coming in and doing business, and somehow they have managed to find loopholes. This presents a tremendous challenge. We're up to the challenge. We present a company that offers high quality, compassion, caring. We, those things trump any hedge fund or private equity firm.
Mm, mm.
They also tend to drive up cost. We've been very, I think, very consistently, we've been probably a lower priced option. Of course, you do have to support your payroll. You do have to support. I mean, inflation has been
I mean, it's a business. I mean,
yeah,
every business, you have budgets, you have projections, you have inflation indicators, inflation factors you have to figure in, taxes, things like that. You know, the overall narrative for a lot of urgent cares, and we were talking about it earlier. You know, the proliferation of urgent cares, particularly in the city, has been uh, part of a dynamic narrative that's out there. Every inner city has a liquor store, church, mosque, and or urgent care.
right,
And it's not to be funny. I'm happy to see urgent care. I think people need to understand in some regards the way urgent care have worked. They worked in the past, and what I mean how they worked in the past is, it was a question of not are you sick, but how sick are you? Because you didn't have urgent care, you had hospitals. And so the stigma going to the hospital is not that you were sick, but could you really pay for the care? You know what I mean?
right,
And so urgent care is that community space in terms of, I don't want to say what may be lower health concerns, you know. And we talked about it earlier. Is it really a situation scenario where we're talking about not so much preventive health care, but it's tiered health care? Because there's a difference when you go to, we used to joke about black people don't go to the hospital. We go straight to emergency. And there's a lot to that. And a lot of it, we only did one trip to the emergency. You didn't come back. It was
right.
at that point, it was at that level. Um, how, because I'm trying to also understand, what were the attitudes that changed towards healthcare? Uh, in one, and number two is when they first were doing urgent cares, you had a high presence of doctors. Now we do urgent cares. We do have a doctor, but it's medical assistants and nurse practitioners. And I think you alluded to that as well, because that does have something to do with how people perceive the care that they're getting.
Right. Well, I will tell you this: urgent cares um, came into being largely as a cost saving measure for insurance companies.
Mm-hmm.
Because, like you said, I actually, I mean, this is going back a while back, but I had a sports injury. I tore my ACL, and and I'm seeing the comments here. I'm sorry, but but I did tear my ACL, and like back then, the concept of urgent care just wasn't known. I ended up going to an emergency room. The emergency room did absolutely nothing. They took X-rays. They did a certain test to check the ACL, and at that point, they wrapped it up, sent me home, and mailed me a bill for $2,000.
I
Uh,
hear you.
yeah,
Well, we have some people that we always introduce. We call them a shout out show family. We have a special visitor who came here just to see you. We have Sister Ree, Sister Ree with
yeah.
cleaning service. She said, "Hello, family. Welcome to the show." Assalamu alaikum warahmatullahi wabarakatuh to my dear Sister Ree. Shout out to Derek and of course your young lion Jawad. We have our brother Altaf Rashid all the way from Toronto, Canada. He's actually our only Canadian envoy to the show, making sure the quality of the show is good on both sides of the border, the Canadian and the U.S. We also have my brother Johnny L. Thomas. Thank you so much. Wa alaikum assalam wa rahmatullahi wa barakatuh. Tuning in. He just sent a young man to Harvard, not to Harvard. I'm sorry. He just sent a young man to Yale. Good to see him. Zane has a question. Would love to know his interest as a child role model, such as a sibling. Maybe you can tackle that one a little bit before the break. And of course, he can only get. How did you tear your ACL? Well, let's answer that one real quickly.
I was just
Since there
I was
was
just
no,
playing
since there was no urgent care back then.
Yeah, it's just playing basketball, and I tore my ACL, and
But you're a hooper. I think Zane needs to understand that you were a hooper at the time.
yeah, I was definitely. I mean, Zane knows me very well. I think he would really struggle to step on the same court with me. Um, you know, we used to play a lot back in the day, and so he knows very well. He's actually, I think, he knows the story pretty well. So
So I say shout out to Zane too, as he's sending his young son to Harvard. Shout out for that. And of course we have Brother Bilal Salahuddin, and by no default, his queen sister Sonia Salahuddin Dalton doing work. Glad to see you on the show, beloved. Assalamu alaikum. Well, I say wa alaikum assalam wa rahmatullahi wa barakatuh to you. Let's get into this thing, man. You're at University of Texas because I really want to understand, how you get into healthcare.
Well,
Like,
that's a great question. Actually, well, I have a degree in biology. I went to business school after that. I got my MBA at
mm-hmm.
Rice University. I have a focus in finance, and I worked in corporate finance for probably about 15 years.
Okay.
And at that point, honestly, like I got pretty tired of just doing uh, basically like financial analysis type work. I mean, it's very informative. It helps you understand the mechanics of a business, especially very large businesses. These were typically Fortune 100 type companies that I worked for in the oil and gas space, as well as in the airline business. And as it was great experience. It was very foundational. Helped me tremendously to like with the job I have right now. And
Mm-hmm.
my brother-in-law is a physician, and I think at some point, probably about 12 years ago, we got into talking about maybe about opening an urgent care clinic. And I think what was really badly missing was just the management side, the experience, like business, financial,
I think
operation.
that well, I think what's of interest is how you move from biology to the business side of it, and I think it'd be a really really interesting question to talk about how you navigated, a pandemic. How do you? Because to me conceptually, it's a total foundational shift from what you're offering, for what you're doing to this is the main thing that
Yeah,
it's a
it was.
it's a testing economy, for lack of a better word. And we were confronted with something we never seen before, at least not in my lifetime, whereby we had something that was affecting people's health. We couldn't see it, we couldn't touch it, it wasn't tangible in that space, but we had to protect ourselves, and it grew all different kinds of economies: a testing economy, gloves, mask, hand sanitizer. I mean, we had everything you could think of, and you're in the middle of it. And I want to even say, even more clearly, you're front line. You're dealing with people who are coming in who have COVID, who test for COVID, and you got COVID. Staff gets COVID. It's the craziest thing. You're trying to serve, but you're putting yourself in harm's way in some regards.
Oh, definitely. I think that one of the very first problems that we faced was the fear that our staff was experiencing. This was a completely new virus. People didn't know anything about it. There was a tremendous amount of fear. There was a lockdown. We had a great deal of resistance, and we had numerous challenges on the employment front. I mean, staffing became a huge problem. Staff. I think I'm not just here, but just everywhere. Not only were they resistant to dealing with COVID patients at all, but we also went through a massive inflationary spike with in the past 2 to 3 years. So you're seeing rising costs due to supply problems. You're seeing labor shortages. You're seeing a great deal of resistance. So there was a great deal of difficulty navigating through that. At the same time, we have a tremendous team here at Convenient Urgent Care. I think that's one of the things that makes this such a special company to be a part of. I look at it as a tremendous example of teamwork. We have staff that was very committed, very devoted, worked well, extremely well together, understood the issues, and dealt with it together. Due to that sort of unity, I think we were able to accomplish a lot and navigate through all these significant problems. In fact, I don't know if I mentioned this, but the supply issues, finding gloves, finding masks. There were periods of time when something like lidocaine or something like dexamethasone medication, basically supplies that we would use. These are injectable supplies, but clindamycin, various medications that we couldn't find. We had to improvise in some ways. There was just very recently, even there was a huge lidocaine shortage due to some sort of supply disruption in simply the bottle that that lidocaine was distributed in. So we're encountering these types of things constantly. I think the fact that our patients don't necessarily notice it is a great thing.
All right, well, we got a comment here. Said, I heard your brother was a huge part of your life. Is that correct?
Oh yeah.
I don't know why it says my brother a huge part of my life. Of course.
Well, of course. What kind of question is that?
There's questions that get asked. Questions get asked.
Yeah,
hey, listen, we're going to take a short break. We're going to come back. I just had to throw that out there. Don't you guys move. We're talking with my main man, Aijaz Syed, CEO of Convenient Urgent Care in the city of Houston. Don't you move. Bye-bye.
Tarife Atar. The scent of enlightenment. A gentle reminder that air, water, and fire indeed are life-giving essences. Appreciate the intersection of time and luxury. Magnify your essence. Tarife Atar.
All right, my brother. Well, that's one of our ads. Tarifa Atar. I want to give a shout out to Jordan Richter. He is the official provider of scents for the show. As a part of being a shout out show, I'll make sure that you get a couple bottles of Tarifa Atar. Good when you're looking for that first or second wife. Okay, I'm just kidding. Hold on a moment, brother. Uh, I hear you. I got your comment. Thank you. So listen, let me break this down a little bit. Let's get a little bit serious. You know, we have a population that's aging. We have a population that's aging, and we're kind of running into this space where we're out of that phase of COVID. We just had a situation where millions of people lost their health care. Medicaid, Medicare, they lost it. And now they're kind of thrown in that space. How do you deal with people that walk in and don't have money to pay? They don't have insurance. How do you deal with that?
That's honestly a very tough question. We honestly we don't so much run into people that simply don't have any money. I mean, I think that we are in the areas in which we operate. We do have a significant Medicare, Medicaid population,
Mm-hmm.
especially Medicaid. Um, so we don't really encounter people that just simply have absolutely nothing to pay. We do offer, discounted rates for
Mm-hmm.
self-pay patients. I think that, that's our primary way to address that issue.
Sure.
Um, now if somebody were to come in and they absolutely have nothing at all, I mean, we do try to work with people to the best of our ability. That does get, somewhat difficult. We might try to connect them with resources that can help them in that case. Um, Otherwise, the fact that we discount our self-pay price, if you look around at most urgent care clinics, they operate in quite affluent areas where the price point might be, 160 to $200. We priced our office visit relatively very affordable at $95.
Let me
Uh,
ask you. Let me ask you this question, um, because I kind of the placement of urgent cares in affluent areas. Because you would think people in affluent areas they have insurance through their job or they're self-employed. They get self-employed insurance. You think that wouldn't be an issue. However, it seems like it is a real issue in the affluent areas.
With insurance, yes, absolutely. I mean, if you look at the cost of healthcare insurance, it's gotten quite expensive. I mean, for myself, my premium has probably gone up about 60% in the last 4 years,
Mm-hmm.
and that presents a huge problem. And the coverage has actually diminished. I mean, if you have, let's say, we do encounter a lot of patients that come in here. They have what they think is, they have good insurance. They're
Right.
maybe paying $300 a month, and they realize that their deductible is $8,000, and you know that really hurts people. You know, People have trouble understanding that and grasping the idea that, like, look, you're really truly only being covered for catastrophic, like, type of issues.
Yeah,
And
yeah, yeah. I mean that to me, I guess you know what I mean when we're talking about insurance and how it works and what it's supposed to provide for. It just seems like the wool's been pulled over people's eyes, and there's a romanticism to having insurance. Would you agree?
yes, I definitely would. I mean,
Because we talk
I think
about I got a good job, I have insurance for my family.
right.
Um, even in the workplace, in the workplace sector, the benefits that you normally would get like 10, 15 years ago, these are not gold plated insurance situation, you're paying out of pocket.
You know, I think this is largely a political issue.
Mm-hmm.
I think the best thing that we can do, as I'm not a politician. I'm not. I have no interest in being any such thing. But as people that are voters, the best thing you can do is try to understand the healthcare industry, understand what those issues are. We have.
Mm-hmm.
One thing that I've seen over the years, and that that upsets me, is that if you were to look up the stock price of your any insurance company, it's gone nothing but up for the last 10 years. And you know but I don't think that healthcare for Americans has necessarily improved. It may have improved in certain areas, but overall, people are paying more, getting less.
Well, I guess my thing is, uh, what you're saying is 100% true. I have no problems with that. But I don't understand. I guess how do we resolve that? And I mean, I don't want a political
Yeah.
situation per se for me.
Yeah.
The best way I can deal and have good health care begins with having good health.
Yeah, I think that that's, I mean, honestly, like, the answer I would have probably would be political, and it would be, I think that you would have to solve some of the issues with like inflation and, the causes of that inflation. But beyond,
Yeah.
aside from that discussion, I mean, really, like, we see a great deal. We do operate in primarily underserved areas.
Right.
We see a tremendous amount of or a lack of knowledge about like healthy eating habits.
Hmm.
We see a great deal of obesity, a lot of like diabetes, heart disease. These are constant. We see huge amounts of these problems. I'm going to answer this question real quick about Molina and Ambetter. The answer is yes. The simple answer is yes. I think that with Ambetter, there are a couple of HMO plans that we don't accept, but otherwise the answer is yes.
Yeah. I mean, I had a situation a couple years back. I had some insurance company that shall remain nameless as well as useless. It literally took the little insurance card in for prescription. You realize, man, that you're paying, in some regard, you're just paying for the right to say I have insurance,
Right.
but it's not I have good insurance. What is a good way? Because somebody may come to convenient urgent care. What's the best way we can prepare them to be able to use insurance, be more knowledgeable about how to engage with urgent care?
Well, when a patient walks in, we check their healthcare insurance at the front desk.
Mm-hmm.
Um, you know, a lot of times, unless the patient has been to our clinic before, we have their inform. We wouldn't have any access or knowledge about like what they've chosen as a plan. Um, when they come in, we do have to quite often engage in a discussion about, okay, this is your copay, this is your coinsurance, this is your deductible, this is your out-of-pocket maximum. Quite often, people don't really have an understanding of what those terms mean.
Mm-hmm.
We do have to go through some discussion and to educate them about the meaning of these terms. And quite often it does end with, I mean, during the discussion. Now, our patients are very gracious about it. They really appreciate you taking the time to explain what those terms mean. But, they are always disappointed that like, hey, I'm spending, whatever, $300, $400, $500 on insurance, and yet I'm still having to pay out of my own pocket.
Yeah, I mean, that whole idea that you talked about, this whole concept of catastrophic insurance is, which means the only way this is going to work is things got to end up really, really badly for you.
Yeah, if I think, mashallah, I mean, I'm very happy to say that, I do pay a lot of money for my health insurance, but, very happy to the fact that I haven't had to use it.
Alhamdulillah. Well, I feel the same. So, I mean, let's get let's drill down a little bit, specifically move away from the politics and things like that, man.
Sure.
Give us one of your happiest days at Urgent Care.
I, I have to say it's not necessarily any particular day.
Okay.
It's just simply the fact that I have had a tremendously loyal staff.
Right.
We have incredible reviews. We have great values as a company, and we have built an extremely strong team. I think that that's the thing that wakes me up in the morning. I think that's what that's what um, allows me to confront some seriously difficult challenges that I've had to face over the years. We didn't always have it easy. We had, especially in the first few years, we had a great deal of difficulty.
Mm-hmm.
I think that we had sort of a
What was some of the difficulties?
difficulties were around. Well, at the time, I wasn't CEO, and we did have various people kind of pursuing their own kind of agenda. I think that there wasn't a unified vision in the first couple years. I kind of I think in the first few years I was a fairly passive individual, and I deferred to others at the time. But I think this really drove my and kind of allowed me to develop a side of myself which I knew was there,
Mm-hmm.
and I uh, I just never quite like pursued. There is a certain leadership style, a certain certain qualities of leadership type qualities that I've never allowed myself to really to really develop, and I think that this encouraged me to do it. And I had to step up, meet a challenge, and basically confront some very serious challenges, and that's probably one of the best things that I've ever had to do in my life.
I love it. One of now this is not a professional thing. I love community urgent care, but one of the things I do love about a community urgent care is when I go there, there's a Muslim that I know.
Yeah, yeah,
Let's just call it what it is. There's a
yeah.
Muslim that I know. There's a Muslim doctor that I know. Man, how does your faith frame your ability to build teams, build diverse teams? Because when you walk
Quite
in
honestly,
urgent care, it's not all Muslim. You
no,
are looking at putting a team together that has to be high performing. They have to have
yeah,
a high level of efficacy. People coming
yeah.
through the door, they have to be able to understand customer service. They have to be diverse in their roles, man. How does your faith help you do that?
Well, I'll be honest with you. I, my faith definitely guides me. It guides me in, in selecting and in nurturing everyone. And I have people of, I've had people from, you know, every ethnicity. I've had people of all sorts of religion, different religions. I don't look at people in that sense. I don't pick people just based on that basis. I appreciate people for what's in here, what's in their heart,
Mm-hmm.
what's in their mind, their ability to learn, their ability to also follow, and
But
eventually,
I guess what I'm asking is like, how does it fine tune your willingness as a believer to serve these communities?
I think that that's our mission in life. I think
Mm-hmm.
that is the mission. We what we do here is a reflection of that. Of that. Basically, what are we seeking? As for me myself, like what am I seeking? What am I doing? This company to me is an extension of my faith.
Yeah, it takes a special person. Like, when you say, I want to be a doctor, what you're saying is, I want to be around sick people. I want to help people heal, but I want to be around sick people.
It's a very interesting. One thing I'd like to add to that is that, that's just one aspect.
Mm-hmm.
We are not only, are we seeing patients? I mean, we're probably closing in on having seen around 200,000 patients in 10 years. At that point, you realize that 200,000 is quite an achievement. Also, we have numerous employees here whom I've seen, there are employees, these are the medical assistants, hard to do this with a doctor, but like there are medical assistants that started out, 6-7 years ago, and, they've doubled their salary,
Well, I think the thing is,
years. And it's an amazing thing to not only to treat patients, but to see your staff develop, because you've basically nurtured them. You've given them the space and freedom to,
well, you provide a culture.
yes, exactly.
In 10 years, you're building teams, you're seeing people, you're engaging in community effective, community health, if you will, community wellness. You're doing that. You have people come see you. They come back to see you. These people reframe, if you will, what they think it is to go see a doctor,
Yes.
to go get checked out. They come out of their shells in some regards. I think, beginning to look at that. I haven't seen the whole 10 years. I've seen the last couple of years. I've been involved with convenient urgent care on multiple levels, as you know. But I think the thing is, there's a warmth and there's a trust. And as you go into year 11, I think it's interesting to ask the question. It's like, well, where do you go from here? And I don't want to say, what do you think the trend is for urgent care as a healthcare? Where do you go from here? What are the things that you're focusing on at a business level, and the things you're focusing on at a community level? What are you guys thinking? What are you feeling?
Well, that's a great question. I mean, these are things that we're, kind of continuously looking into and trying to develop. We are somewhat limited in the sense that, like, we are locked into contracts with insurance companies. So operating too far outside of like what we've our contractual obligations is a little bit challenging. But I have recently branched out. I did start. I took over a home health company recently. I think that home health it's been plagued by a lot of like very shady type of operators. It tends to be a field where each patient could yield at least a couple $1,000s a month, and so people tend to look at that as like, hey, this is easy cash. It's not. We're taking care of largely elderly and largely like patients that have mobility issues. They may have all sorts of types of health issues, but bringing the values that that we have at Convenient Urgent Care, bringing that to another sort of like type of company. I think that there's tremendous room there, because what we ultimately want to bring to the community is
Well,
those values.
let me interrupt and ask this question.
Mhm.
We started out the show by talking about home health care. I mean, urgent care has been around since the 70s, but urgent cares were kind of developed and funded by the hospitals. Now you have urgent cares. Is there a thing where now urgent care can do the same thing with home health care?
No, actually, these would be completely different operations.
Okay,
It's a
all right.
completely different line of business. It just happens that, like, because we've done, we've done well doing urgent care. We've reached a certain level of proficiency. We're still continuously trying, like working on improving. We don't believe we're perfect, and we do have to stay on our toes and like continue to improve. I mean, we tend to do that a lot with technology. We try to bring technology to solve certain problems, communicating with patients, allowing them to have access to the care that was given to them. and their health records. That these are all very important things. It also requires a ton of employee training.
Yeah.
But considering we're doing well in urgent care, I think what I see is I saw basically a scarcity of the type of values in home health.
So
And
speaking of employees, man, are you dealing with a high level of, because after COVID, they have a term called quiet quitting.
yeah.
Are you dealing with issues of turnover?
Oh, during COVID, it was tremendous. I mean, that
Hmm.
was a very significant problem. I mean, we had numerous people um, that left to work at hospitals just simply because, well, during COVID, they could get a 1 month, 2 month contract making, 50% more.
Right. Okay.
But the catch was that, okay, you left, you got 50% more for a month or 2 months, and then you're out of work. So and it wasn't like that for everybody, but we did have a number of people that ran into that type of situation.
Well, I think that they were converting with urgent care is that's not remote work. you
Right, right,
It's hands on. You've got to be there to do that.
right.
But there was a plausible shift in people how they felt about going to work life balance, things like that. Did you see that in the workplace?
Yes, definitely. We do kind of see that a lot with the current generation. What are they called these days? Gen Z. Uh,
Crazy? No, I'm just
we
kidding.
we
Crazy,
we
not Gingy.
do.
Crazy.
Yeah. I actually have a very, very fun interaction with the employees here. I do have a number of people that are Gen Z, and we have our fun with it. And but the one thing that I tend to look for in employees is that they're willing to listen.
Hmm.
They don't. Like, I mean, sometimes I have to be a bit tough, and you know I always try to tell them that, like, look, I'll be tough on you today, and I'll forget about that. Don't worry. Like, I mean, it's not just because I was tough on you doesn't mean I don't care about your well-being and your confidence and and developing your abilities. I'm being tough on you for that very purpose. And they tend to respect that. I mean, I think
So they do understand that.
yeah, they do. And those are the types of people that I look for. Those are the people that I retain. If I identify that, hey, it's just not going to work out with this person, this person's not willing to learn, is not teachable, then I'm going to have a problem, because unfortunately there are a lot of individuals that have that kind of attitude.
And what are some of the attitudes of the people that come into convenient urgent care or urgent care in general? What do you see in terms of attitudes?
You mean in terms of employees?
No, actually, the people that come in to get assistance.
Oh, okay, like patients. Okay. um we deal with all sorts of things. I mean, sometimes I'm kind of smiling because I wish you would have our front desk staff up here, because in here talking to them, because they do go through some challenges. There are a lot of people that will come in with you know they don't have insurance. They claim they have insurance. I mean, there are a lot of different personalities. I'd say, you know 80-90% of the time it's perfect. I mean, they're very appreciative, very thankful. They're they're very cordial.
Okay.
That
Yeah.
10% or so where it can be a little bit more challenging, and you have to.
Well, I think part of it is what we. I know when we were kids, when I was younger.
Mhm.
Part of it is like you have to first frame the fact that there's something wrong.
Right,
So that might take you a week or two.
right,
Then once you got it, something's wrong. Then you had to tell somebody,
right,
and that might take another week. And then you told somebody, and then you showed them where it hurt. By that time, you might be healed.
Right.
But it
Yeah.
doesn't work that way. You let me ask you this question. So, 10 years in the business, do you see the American society as a society that's a lot sicker these days? They have a lot more ailments, a lot more issues. I mean, we're in the throes of a mental health crisis right now.
Yeah.
And mental
There's
health weighs on the body. So you might have people come into community urgent care, stress, dealing with stress and anxiety that has a lot to do with how the bodily how the body performs, if you will. Are you
yeah.
seeing that?
Definitely. I mean, in fact, I'm glad you mentioned mental health because I should have included that in one of your earlier questions about like where we plan on going in the future. Mental health is actually another one of those initiatives, but we're probably at least a year away from doing that, if not two. But that is definitely there's a huge problem. I mean, um, especially in these underserved areas, most most you know mental health professionals are not in this area. Um, there's an issue of reimbursement. Some insurance companies simply do not reimburse enough for it to be forget profitable. Just let's even break even. Some of the insurance companies just simply don't pay enough for a visit to a psychiatrist. Guess what? You won't find psychiatrists in the area, or they're very limited. So that presents a really big problem, and there is a rather significant need for that kind of assistance in this area.
Because I was thinking about it. A friend of mine has a podcast, and one of his sponsors for his podcast is a group called Better Health. And Better Health is sort of like a referral to a mental health practitioner.
Mhm.
And I thought of it because I was like, there's times I've been on the road and I've called you, and I've been able to access telehealth. Do you
Yeah,
see a growth in telehealth? What's the market
absolutely,
for that?
absolutely. We actually instituted telehealth in very early in 2020 when COVID started.
Mm-hmm.
We did have it prior to that, but it was used very sparingly. People, there wasn't really a huge adoption of telehealth. But when COVID hit, everything changed. I mean, people were very reluctant in the past to share even their email address. Now, I'm speaking specifically, I mean, I've said it a few times, but these are underserved areas. Um,
Mm-hmm.
and people were very reluctant to share their email address with us. Well, when COVID hit, that changed completely. People really started adopting these things, and we started we do telehealth now at each of our 3 locations, and it's been in fact in mental health care as well. Same thing. There is a tremendous use of telehealth as well.
Yeah, because it seems so practical.
Yeah.
Because you have the workforce that kind of gone remote, and telehealth seemed to be something that it aligned really really well with people who don't come out. As a business model, how do you see it growing?
Um, I think that like with telehealth, I think that the future is looking very interesting. I don't know exactly how far away we are, but I have noticed there are certain types of wearable devices, things that we can interface with. We'll be able to check, blood pressure. We'll be able to check temperature, even certain, in at-home testing
Is
supplies.
it like is it like the virtual doctor? They just take you wake
Kind
up.
of,
Yeah,
kind of.
my mom has that thing where they do the readings.
Yeah.
Is that kind of where we're going to? We didn't
Yes.
even get the chance to talk about just the disappearance of the neighborhood doctor.
Yeah, yeah.
Um,
That looks like that we're headed that direction, and in fact, that's one of the reasons why I try to stay on top of technology. There are a lot of I'm surprised that there are still a lot of clinics that operate using paper charting.
Hmm.
We got rid of that probably 9.5 years ago.
Yeah, what is the resistance for some of those companies to get away from that, to not use the technology that we're talking about right now?
We encounter a tremendous amount of resistance. I mean, I could drag my staff in here and give them a little bit of a hard time if by bringing this up, but I've done this for years. People are uh, creatures of habit,
Hmm.
and um,
Especially when it comes to health.
yeah, I mean, in this case, it's like dealing with new technology that you're not familiar with. There's just a resistance to learning it. There's a fear. I think sometimes there's a fear of, like, I don't want to learn this. I don't know if I'm comfortable doing this. And there's been a great deal of, like, walking people through. We use we use kiosks at all of our clinics.
Uh-huh.
We use telemedicine. We've been using electronic medical records for 9.5 years out of those 10. So out of the 10 we're about to celebrate. So um, I've always pushed for these things. In fact, some of our medical assistants carry tablets to do to enter vitals, and whatever their scope is, like whatever they're entering into the chart, chief complaint and other issues. But that was tough. I mean, you sometimes you're dealing with people like medical assistants. They didn't go to college. They didn't go to grad school. They didn't necessarily get like an IT type training. I was very fortunate. I learned quite a bit of IT. Um,
Yeah,
growing up. So I mean, I use technology a lot, and I'm fairly proficient with it. So um, it's something that I was able to drive that adoption. And uh, I think the providers, the staff, ultimately they all appreciate it, but there was some resistance along the way.
but listen, man, I just want to tell you, brother, that hour kind of ran out on us.
Yeah,
Believe
it
it
went a
or
lot faster than I thought it would.
Hey man, good. Well, listen, good responses, great information makes it a much better show. Listen, man, I want to say something. You got 10 years in. I wish that you have another successful 30. In
Thank
the
you.
next 10 years, I'll definitely be there to make sure we celebrate. Uh,
Thank you.
damn, I'll be. Ooh, I might need it. I might. Inshallah, I'm still here. I'm just doing at 66. I don't know. So I don't know,
Yeah.
but listen, man, you've been a tremendous supporter of the Shout Out Show. Personally supported me in my health issues, and we wish all of us, all of us. I was going to play the theme song for "Don't Get the
Yeah.
COVID," but I
Yeah.
showed some discipline after we talked, and I didn't want to waste time with that, man. I just want to
No,
say, man, continued success.
thank
Anything you
you,
need
brother.
from us here on the Shadow Show, you give us a call, all right?
Thank you so much.
We
I really
appreciate you,
appreciate
man,
it.
and
Really enjoyed talking with you.
I'll be reaching out again. All right.
All right, great.
Assalamu alaikum warahmatullahi wabarakatuh.
Wa alaikum salam wa rahmatullahi wa barakatuh.
That's our show for today. Again, thank you to my dear brother Aijaz Syed for coming on and spending that time with us. And I just want to say, hey, listen, if you're not feeling well, there's a reason for you not feeling well, and you should definitely go get checked out. Don't be like me. Don't try and figure out what's wrong. We're not doctors. Go out and get yourself checked out. Convenient urgent care in the city of Houston, Parker Road, Cypress, and of course Pasadena. Listen, that's our show for today. Assalamu alaikum warahmatullahi wabarakatuh. See you next week.